Hi, I'm Caitlin McColloch, a health scientist at the Centers for Disease Control and Prevention. I'm presenting a summary of my co-authors and my paper published in the American Journal of Public Health titled Promising Practices Observed in High-Throughput COVID-19 Vaccination Sites in the United States, February to May 2021. I want to acknowledge and thank all the co-authors for their contributions to this work. As COVID-19 vaccine development was underway in 2020, public health agencies and healthcare providers across the United States began preparing to administer COVID-19 vaccinations on a large scale. High-throughput vaccinations, also known as mass vaccination, was a key strategy included in these preparations. Although certain vaccination providers had previous experience with large-scale vaccination campaigns, such as for the 2009 H1N1 pandemic, many had limited experience providing vaccinations at the unprecedented scale and urgency of the COVID-19 pandemic or at managing the demanding and differing COVID-19 vaccine storage and handling requirements. Providers, including but not limited to health departments, pharmacies, and community health centers, had to quickly determine how to best implement and manage COVID-19 vaccination sites in their communities. The Center for Disease Control and Prevention, or CDC, partnered with the 64 federally funded state, local, and territorial health department immunization programs to plan for the rapid administration of COVID-19 vaccines. The Federal Emergency Management Agency, or FEMA, also helped establish and support high-throughput sites called community vaccination centers, or CVCs. To become an authorized vaccination provider and receive vaccine, providers were required to enroll in CDC's COVID-19 vaccination program and agree to manage, store, and administer vaccines in accordance with all federal and manufacturer guidelines. Guidelines were associated with cold chain management, vaccine preparation and administration, billing, and reporting. To understand how providers at high-throughput COVID-19 vaccination sites implemented the guidance, CDC and FEMA conducted site assessments during the beginning of high-throughput COVID-19 vaccinations in the United States. Another objective of these assessments was to capture promising practices to share with current and future providers operating these or similar types of sites in the future. And this is the focus of our paper, to identify promising practices for implementing high-throughput COVID-19 vaccination sites. A promising practice was any approach to organize or implement a COVID-19 vaccination site that was observed to have a positive effect on efficiency or ability to adhere to all federal and manufacturer guidelines. Teams were instructed to capture these data through observation and interviews with site staff. CDC and FEMA separately conducted high-throughput vaccination site assessments in 2021. From February to May, FEMA sent site assessment teams to FEMA-established CVCs. Independently, starting in March, CDC, in consultation with immunization programs, selected vaccination sites to participate in the site assessments with the goal of visiting jurisdictions that made up the highest proportion of doses received and accounting for geographic diversity across the United States. CDC sent teams of at least 2 assessors to each site, and assessments typically lasted 2 to 4 hours. We used an iterative thematic analysis process to analyze the promising practice data. Promising practices were abstracted from CDC and FEMA data collections and organized into a spreadsheet for analysis. We also calculated frequencies of sites visited by site setting type. The settings included traditional, such as pharmacy, healthcare provider office, health center, etc. Non-traditional, such as a community center, a college campus, or a temporary or off-site vaccination clinic, and other or unknown. In total, CDC and FEMA conducted 134 site assessments in 25 states and Puerto Rico. Most sites were at non-traditional settings. Of the 96 CDC-led assessments, 58% were at non-traditional settings. Of the 38 FEMA-led assessments, 74% were at non-traditional settings. We identified a range of promising practices during our analysis. Here and in our paper, we highlight 6 overarching themes. 1, addressing health equity, leveraging partnerships, optimizing site design and flow, communicating through visual cues, using quick response or QR codes, and prioritizing risk management and quality control. The health equity theme is associated with providing equitable access to vaccines and vaccine information regardless of demographics, language, disability status, and other characteristics associated with health disparities. For example, Some sites used language handouts to help identify the recipient's language and direct them to appropriate language services. Some had wheelchairs available to transport persons with access and functional needs from site entry through the vaccination process. And some collected and tracked data related to race, ethnicity, disability status, language preferences, or transportation barriers at registration to prioritize and refine outreach. Theme 2 is associated with ways providers use new or existing public or private partnerships to enhance vaccination sites. For example, some providers partnered with public and private entities with expertise in specific operational areas, such as event planning, crowd control, and serving individuals with disabilities to facilitate effective site design. And some providers partnered with community or religious organizations, media outlets, and public transit authorities to support community outreach, particularly for populations who have been historically underserved by healthcare services and groups with lower vaccination coverage. Theme 3 is associated with methods of site design and organization. For example, some sites created separate vaccination areas to allow complex situations to be triaged and handled with the appropriate attention without holding up the primary administration queues. Some stationed a clinician at the check-in station to help address any medical questions or concerns among vaccine recipients before they get to the vaccination station. The fourth theme is associated with the use of different types of visual cues, such as posters, monitors, stickers, tapes, flags, and vests, to communicate with the vaccine recipients and site staff and to promote site safety. For example, color coding was often used to help communicate important information. Color coded signage and tape to direct people to queuing lines, color coded flags or cones to indicate when supplies or support was needed at a vaccination station, and color coded stickers or wristbands to identify staff who have passed daily COVID-19 safety screenings. The fifth theme is associated with the use of QR codes to share and collect information. For example, some providers linked vaccination information to QR codes and displayed the QR codes throughout sites on large posters or adhered to the backs of chairs in the observation area. Some posted QR codes linked to the site's incident action plan at staff locations for easy access to critical site operational and safety information. And some used QR codes to monitor site flow by tracking the amount of time it took vaccine recipients to complete the vaccination process, which was used to provide real-time updates regarding the number of vaccines given, number of individuals queuing, and average wait time. The sixth and final theme is associated with techniques that were used to implement redundancies and create fail-safe systems to prevent loss of information and preserve integrity of vaccines. For example, some providers saved the next day's appointment schedule on an alternative system each day. Some had extra Wi-Fi routers to ensure consistent access to crucial electronic systems, such as registration or temperature monitoring. Or some required or encouraged vaccinators to review a vaccinator competency checklist before providing each vaccination. On the AJPH website, we provide a supplemental table that contains a comprehensive list of examples of promising practices, a few of which are noted on the screen, that subject matter experts at CDC considered potentially useful to current or future vaccination providers. In conclusion, the promising practices identified can be adopted or adapted to potentially increase efficiency and accessibility of current and future high-throughput vaccinations. Further research can be conducted to understand the sustainability, usability, and efficiency of these practices more fully. And continuous learning to support improvement of high throughput vaccination efforts is essential. Documenting how sites innovated to improve vaccination operations and implementation is important for future public health emergency responses and high throughput vaccination efforts. I want to acknowledge the many people that made this work possible, including the staff of the immunization programs and vaccination sites that we visited, the FEMA Continuous Improvement Program team, and the many CDC field staff who helped coordinate and participate in the site assessments. We also thank the CDC site assessment team members that were not co-authors on this paper, as well as many others. Please find our full paper on the AJPH website at the link in the description. Thank you.